Do a little show of hands. Who here are medical providers, medical professionals in one sense or another? Medical personnel of some kind. I know we have a handful on all of our faces. So the folks that are here other ways, employed other places at the med center, elsewhere, coming from off campus?
Yes, med center.
All right. All right, so a lot of med center employees, but perhaps not folks that are directly involved in medical care. So I have for you a few pop quiz questions, and we'll start with the first one. You don't have to say what test you're thinking of, but think about something that you have done when you go for healthcare maintenance exams, a pap test, an mammogram, that kind of thing, some sort of screening test that you have done. Do you know when the last time was that you had this test done? Raise your hand if you can think of the last time that you had one of these tests done. Very good. Most of the people. Okay. Do you know when the next time is that you need to have a test done? Well, you guys are way ahead. We're done. So what I have for you today is I really want to go through maybe just the basic screening tests that we do in women's health, as well as the immunizations. And I really want to do this kind of at the basic level, more so that you have an idea of what we talk about for the community at large. Isn't going to be based on any one person's individual health. That's something that really only you can do with your healthcare provider. But I do want to hope that everybody can leave with an understanding of what kinds of things are appropriate for you to ask your healthcare provider about the next time you're there for like a screening visit or an annual exam. Okay? So why do we do this? When I talk about screening tests, you know what I mean. These are tests that we do early on, okay, so that we can try to catch some sort of disease or illness in progress before it's at the stage that things are, really too late to intervene. So as we go through a number of these tests, we'll talk about what we're looking for. Why are we looking in the early stages? We really do impact health and save lives when we can catch diseases early in the process by doing some sort of screening test. And we also protect not just our individual health, but our public health, particularly when we're talking about communicable diseases, particularly one that comes to mind is sexually transmitted infections. When we screen the population for those, we not only protect the individual's health that we're screening, we protect individuals that may come into contact with them. So this really is important not just for your own individual health, but for our community as a whole. So what I'd like to do is I'm going to go through our tests kind of one by one, is how I thought would be simplest to do this. And pay attention because I told you there'll be more pop quizzes. They'll be here in a couple of minutes. So I started with a pap smear because I think that a lot of women think of this as one of the standard tests that they have to have done when they go for screening exams. So when we go through each of these, I've just listed the details. What is the test looking for? Who needs to have it done? When do they need to have it done? And how do we do it? And I know perhaps it's not the most exciting of ways, but I didn't think we needed any more visuals for a pap smear than just words. I put some pictures on some of my slides, but I didn't think there was anything that was going to be appropriate. So a lot of women, I think, are probably familiar with this. This is a pap smear and screening for cervical cancer or pre-cancer, hopefully. Okay, we're trying to catch that in the early stage. This is for all women who have a cervix. This is something that is, I find a lot of women have been getting pap tests for a long time after they've had a hysterectomy. And it's important for women to know that if you've had a hysterectomy for any reason other than cancer or pre-cancer, okay, bleeding reasons, fibroids, pain reasons, anything like that, if you don't have a cervix, you don't need a pap smear. Period, end of story. You're not at risk for cervical cancer. Again, this is going to be one of those situations that is going to be fine-tuned for the individual. For women that don't have a cervix because they've had a cancer, this is not true. Okay, and that's something that they would follow like with an oncologist. But for your general rule of thumb, women that don't have a cervix anymore, you're done. There's another change in terms of when we start doing pap smears. This has changed over the last several years. And we do not start pap smears until women are 21. It doesn't matter whether or not they have been sexually active. Whether they have been sexually active for a number of years or they've never been sexually active, we start at age 21. Okay? And until age 30, we're going to do that only every 3 years. And a lot of women are used to having done this every single year. We know now that we just don't need to do it that often. We can catch cervical cancer or precancers in the early stages enough if we do it every 3 years. Once women are over 30, we actually can cut that back even further if we do more thorough testing, which is called HPV testing, at the same time. Women over 30 can actually have their pap as infrequently as every 5 years. Okay, and again, this is a basic guideline. Has to be individualized for each of us, but this is what the basic guidelines would say. And most people would be comfortable stopping pap smears on women once they're 65. Okay? This is done in the office during a pelvic exam with a speculum, and we just basically take a small swab of the cells. I'm going to do a few, and then we'll stop for questions. That's okay with you guys. One of the next screening tests is gonorrhea and chlamydia. Okay? These are sexually transmitted infections, as I bet a lot of people are aware. We have a really high rate of gonorrhea and chlamydia here in Douglas County, substantially higher than the United States as a whole. So this is really important that we're doing this here as well as everywhere else. Women that are 25 and younger, there's actually a recommendation that they have this screened every single year. Okay? We, in the past, have only been able to do this with a cervical swab, so similar to having a pap smear. Now we can actually do this with a urine sample, which makes it a little bit more comfortable for patients, potentially a little bit quicker and easier, which can be really nice. In terms of screening tests, we like to make them, we like for them to be relatively inexpensive so that the burden of doing the screening is not so great. We like them to become more comfortable for the patients. We're not going to do something for screening that's uncomfortable, painful, terribly expensive. It just doesn't make sense. So these are really important sexually transmitted infections to look for. And lastly, in terms of the sexually transmitted infections, HIV testing. And this is something that at least I find a lot of my patients have not heard about. I don't know if that's true for everyone here today. The CDC is recommending that all adults be tested for HIV regardless of whether or not you have any risk factors whatsoever, at least once in your lifetime. And they define this as anyone 15 to 65. They also recommend any pregnant women, which isn't, again, like I said, the focus of my talk or the focus of my work, but all pregnant women should have it. That's something we've done for a long time, but the recommendation for all adults to be screened is kind of new. This is a blood test. If you get it done in like your doctor's office, it would typically be a blood test, but we also can do an HIV test with a really easy, quick swab of the inside of the cheek, and that usually can be done in between 15 to 45 minutes. That can be back, and they're just as reliable and very effective. So I'll stop for questions about pap smears, gonorrhea, chlamydia, HIV. Any questions about screening for those? All right. Mammograms. A lot of women have been through this. This is screening for breast cancer. Okay. This has been a source of some controversy over the last few years. Because the recommendations from when we start having mammograms have changed over time. I don't want to get into that too terribly much at this point because that's really something that you have to discuss one-on-one with your provider. But for our purposes, starting at age 40 to age 50, women are going to start needing mammograms. Most providers are comfortable stopping at about age 75. And the recommendation currently is that we would do this every other year. Some women, some providers are still going to be doing this annually or every single year. But right now, starting at age 40 to 50, every other year is probably adequate for most women. Okay, if mammograms are done, there's a picture here. This plate that you can see that the radiology gal has her hand over, this plate is basically you kind of place the breast on here, and then this clear plate kind of comes down and basically compresses the breast tissue. It is uncomfortable. It's not the worst thing that most women have been through, but mammograms are not a comfortable test, unfortunately. They're quick. And then basically that takes an x-ray. We've got to compress that breast tissue as well as we can so that the radiologist can get a really clear picture of what it is that they're looking at. Compare it from here to here and that kind of thing. A DEXA scan is a screening test for osteoporosis or thin bones, or the precursor to that is osteopenia. Less thin bones, but not normal. So we recommend starting this when women are 65, but potentially substantially younger if women have risk factors. And I've listed a number of them out here. As you can see, some of these you can intervene on, but some of them you can't. Being a heavy smoker thins your bones substantially. Using alcohol somewhat heavily thins your bones. But your family history, your race, steroids we sometimes have to use for medical conditions. Unfortunately, these things we can't do quite as much about. So sometimes it's appropriate to start this quite a bit younger than 65. I will do this as young as 35 to 40 in a woman that I feel has like really serious risks. Typically, if I have a woman that's a heavy smoker, perhaps for most of her life, I might start this at more like age 50, which is still substantially earlier than we typically would. But osteoporosis is a really serious problem for women. So we like to get this screened as appropriately as we can. we're going to do this between every 2 to every 5 years. If you have your routine screening dex at age 65 and your doctor calls you and says it's completely normal, a lot of providers would be comfortable waiting 5 years. However, if you have thin bones or you have ongoing risk factors, we may tighten that gap, and it may be closer to every 2 to 3 years. This is a picture of the DEXA scanner. So there's a little pillow here, and this is the x-ray machine. Essentially, you just lie down on your back here. We do DEXA scanning. We take basically an x-ray of your low back and your hip. Sometimes we do your arm as well. And so this is basically a specialized kind of x-ray. Very easy, very quick, painless. Much less so than, say, a mammogram. For our last one that we're going to go through. So slowly, sorry. Our last one that I want to go through is colonoscopy. Well, I think unfortunately everybody is familiar with colonoscopy if you haven't had it done. You've probably heard of it. This is a screening for colon cancer. Colon cancers are very, very treatable if they're caught in the very early stages, and they can sometimes even be removed completely. We don't start this typically until age 50, and we're usually comfortable stopping about age 75. This needs to be done about every 10 years, and it's a test that involves drinking some what's called PrEP. This is much less painful than it's been in the past because we have something new that patients can drink. You can mix this with suffering with a big jug of Gatorade, and patients seem much happier with it than the old gallon of Go Lightly, which unfortunately tastes really bad. But you've got to drink a lot of stuff to clear out the bowels. That's the only part that's hard. Then you show up for the colonoscopy, they put you sound asleep. It's all over in about half an hour. I will tell you, for what it's worth, my patients that have had this done always say it's not as bad as they thought it was going to be. People do not look forward to having it done, but honest to goodness, to a person, when my patients get it done, they say it really wasn't too big of a deal. And like I said, it's only every 10 years, so I always tell people, if you could just get it done, get yourself in there, get it over with. You've got a free pass for 10 years if it's normal. This is a picture of Katie Kirk's husband having his colonoscopy on live television, as you can see. So if you think you feel nervous about having a colonoscopy, you just don't have to do it for millions of people. So that's the end of my screening test. Questions about that? Questions about other screening tests we didn't talk about? It's almost time for the quiz. So what I'm going to do...
Regarding the colonoscopy, if a polyp is found, what is the standard for recheck after that?
That's a very good question. It depends on what they find in the polyp. Okay? There can be more worrisome polyps and much less so, and there's a bit of a range there. If it's a more worrisome polyp, usually a gastroenterologist will say 3 to 5 years. If it's completely benign, it might be as much as 5. Some gastroenterologists will let people have a free pass for the whole 10 years. It really, unfortunately, depends very much on what the pathology report comes back as. But we can usually give people a pretty clear answer once we see the pathology report. We can usually get a pretty clear, defined answer. Yes?
Do you have an end date for mammograms?
We typically will continue mammograms until 75. One of my deciding factors in terms of screenings in general is if a person is getting to the point that they are too elderly or too frail to go through any kind of treatment for what we're looking to find, okay, so for a colonoscopy for colon cancer, if they are way too elderly or frail that they would ever be able to have any kind of treatment, then screening for that disease is probably not appropriate. Does that make sense? Looking for it if you're not going to do anything about it, why go through all that? Same thing like with a mammogram. Again, that's a more comfortable test. But some breast cancer treatments can be more involved and can be hard on the person. And if a person would not ever be an appropriate candidate for it, then we usually wouldn't ask them to go through the screening. Because that's the whole point, is to catch a disease that we can do something about. But typically we would tell women about age 75. I mean, I have women that are in sparkling health at 80 and they still want to have them, so, don't argue. Please.
If you've had cancer elsewhere, should you get a breast exam every year or still go every 2 years?
That's a good question. All women, at this point, we recommend all women have a clinical breast exam in the office every year. So even a personal cancer history doesn't necessarily matter. I would like for all my patients to come for a clinical breast exam in the office every single year.
And I have a kind of a question. It's not exactly about the screening, but Is there any, I know that the gonorrhea, the STD rate in Douglas County has been higher than the national average for several years. Any reasons? Have they come up with any kind of data? Any kind of, like, why?
Why that is?
Yeah.
It's a very good question, and I think it's a huge number of different factors. I've heard different public health folks talk about that they think that part of that would be due to a huge change in, a huge increase in our immigration from international immigrants, and that we're not getting the education out there that we need to. You know, that we're missing huge portions of our population with language barriers, with cultural barriers, you know, and that then we have huge populations that we're missing. You know, are we not screening people appropriately? It's young people predominantly. It's 15 to 25 is the portion of the population that's such a big risk. And so again, reaching that young population is always hard, and it always has been. But it's that teenage kind of early adolescent age that we're not getting to them the way we should be, unfortunately. Yeah, it's unfortunately been the case for many years.
Yeah, it has been.
It's surprising, but it's been that way for quite some time. I'm sorry, folks, this is so sluggish. Can you troubleshoot this at all?
I wish.
I don't know if it's just going so slowly.
How much sooner should you get your colonoscopy if you have a family member that had it?
Question. So what we typically recommend, thank you. Well, I have been. This one? Yeah. All right, I'll keep that. Sorry. What I recommend for people who have what's called a first-degree relative that's had colon cancer, meaning your mom or dad, your sister, your brother, or a child, those people are your first-degree relatives. So your grandparents do not count. They don't increase your personal risk for colon cancer. We recommend, so say if my father had colon cancer at age 47, they would recommend that I would have a colonoscopy at age 37. So 10 years before a first-degree relative had a colon cancer is when most people would recommend screening. There are special populations that have like genetic syndromes for colon cancer. It's uncommon, but we do have some families here in town that have that it's a completely different ballgame for them. They sometimes start as young as like age 10. But for your average folks, if it's a first-degree relative, 10 years before your family member.
What if it was an actual colon cancer, just one of those polyps and all that?
The normal screening. If it's not colon cancer, we would generally recommend normal screening. So the last two are just blood tests. Cholesterol testing. Recommended that we screen people for high cholesterol between 20 and 65. That might sound young, but high cholesterol, unfortunately, is a pretty significant problem in this country. And so we do recommend that we go ahead and start screening people fairly young. About every 5 years, but perhaps as frequent as every single year if the numbers are looking higher than we'd like them to be. This is done with a blood test. And I did want to let everyone know that you actually don't typically need to be fasting to have your cholesterol drawn anymore. They did a big study of several thousand people, and they found that there's actually just a pretty small difference when we're fasting versus when we're not. So most of the time, you can have a cholesterol test without fasting at all. And then lastly, screening for diabetes, another kind of internal problem, not cancer. Screening for diabetes or high blood sugar. This is recommended for all adult women and men, but for our purposes, women, with a BMI over 25, which is the top end of normal. I'm losing weight, my BMI only very recently approached 25. So if you're any rounder than me and you have one risk factor, I listed a handful here. I did kind of want to call your attention. One of the risk factors that they recommend we screen for if anybody has an elevated BMI is physical inactivity. So this is a lot of people, okay, with a BMI over 25, and not, that basically means people that don't get consistent exercise several days a week. So there's a lot of folks that should be getting screened for diabetes. Having high blood pressure, having high cholesterol, having had gestational diabetes, okay, pregnancy-related diabetes. PCOS is a syndrome that women can have that increases our risk for diabetes. We do this every year to every few years, okay, and that's going to be pretty individual. Again, blood test, but you don't necessarily any longer have to be fasting. This one I actually kind of prefer that my patients are fasting if we can make it happen because it's a slightly more sensitive test. But the American Diabetes Association now has given us pretty clear guidelines for how we can diagnose diabetes based on a non-fasting blood sample. So it's nice, you know, if people are here, if you're just in the middle of the day at your doctor's office, now you can potentially get your cholesterol screening, your diabetes screening on your way out the door. Don't have to do that whole fasting after midnight, come back in a couple of days, which saves a lot of time and trouble potentially. Questions about these couple? All right, on to the quiz. So I have a handful of fictitious patients for you. These are their real ages. She's 25. She's a healthy young lady. She travels a lot for work, but otherwise has no exposures. What does she need in terms of screening testing?
Domestic violence.
I'm sorry?
Domestic violence.
She definitely needs to be screened for domestic violence. I felt like I didn't want to make that joke. It's true. We should screen our patients for domestic violence.
Yes.
Anything else?
Half.
A PAP. Okay. So she's 25. PAPs for young women in this age range every 3 years, right? So she needs PAP. What else? Cholesterol. GC chlamydia. Okay, gonorrhea and chlamydia every single year.
Chris Brown's dirty.
Did someone say HIV? Okay. Anything else? We've got it. Just let us know again. A breast exam? Absolutely. Oh, so sorry. It's so early. Well, you've gotten all the right answers, but we're not going to be able to move on to our next patient. Maybe the computer's just running on my side. There we go. Here. Slowly but surely. So like we talked about, she's over age 21, so she needs PAP every 3 years. She needs a gonorrhea and chlamydia every year. She should have gotten an HIV test at least once. If ongoing risk factors are there, okay, new partners, drug exposures, whatever, then potentially more often. She's over 20, so we generally recommend a cholesterol test and a diabetes test. Somebody mentioned a clinical prostate exam, very good that, and unfortunately domestic violence screening for sure. So I tried to do this just a little bit differently if this would help people think about it. So I have the age range listed here. So from 19 to 25, these are the things that would be appropriate, okay? So I thought this would help. Everybody should fall into one of these ranges. Okay. She is a skinny, organic, food-eating, Coldplay fan, 40 years old. What does she need?
Yeah, she's skinny.
Okay. She is skinny, at least, right? So she needs a PAP. She is at that 40-year-old cutoff for a mammogram. So, like we talked about, there's some discussion about 40 to 50, but a mammogram would totally be appropriate to consider. Anything else?
So if she smokes and she's skinny, she would be maybe possibly needing a DEXA scan.
Okay, that's absolutely a good point. She has a number of risk factors. I don't know that she smokes, but maybe she does. You know her?
We hung out last weekend.
So if she's been a lifelong smoker, she is quite thin. She's Caucasian. I don't know about her family history. I didn't dive that far into Google. But she would be someone you would consider. 40 is pretty young, just for having been a heavy smoker. But it's absolutely something to consider. So 26 to 49. PAP we've talked about, HIV we've talked about, we discussed over 40 to 50 for the mammogram, and again those cholesterol and diabetes tests. All right, she is the best looking, fittest 55-year-old I could find on the internet. Holy Moses, what does she need? What did I hear someone say? A colonoscopy. So, yep, she needs the same things as our previous patients, essentially, but since she's over 50, she should have had a colonoscopy sometime around age 50. So your PAP, HIV, mammogram, the cholesterol diabetes screening, and then the colonoscopy starting at age 50. So then I have the age range now 50 to 75. Okay. Any other questions about screenings at all?
Vitamin D.
It's a good question. So vitamin D is very important for women for our bone health as well as our cardiovascular health. It's been in the news a lot recently. It perhaps has ebbed a little bit, but it's gotten a lot of play. We were for a long time screening women with blood tests for vitamin D. There's not a clear recommendation that we do that anymore, but I'm generally not opposed to screening a vitamin D level if I think that there's any reason to do so. The recommendation at this point is not that we screen every woman, all comers, just because you walked in the door kind of thing. But there are still a lot of very good reasons to check a vitamin D level.
My question is, a year and a half ago, I went in for my checkup, and my doctor was like, we're going to check you for vitamin D. And I'm right away thinking, oh, osteoporosis.
Sure.
And she says, oh, no, for heart health. They're finding out more about heart health. So I'm thinking, no big deal. I'm going to drink milk, Get my test back, and it's like 29 and a half, and I guess low range is 30.
Mm-hmm.
So, she's like, want you to go on vitamin D, and I'm like, how about I just take my calcium with D like I'm supposed to? And I'll check back with you, and and try to get more sun and all this. So I did that. It was winter time, so couldn't do so much about the sun, but took my my calcium and everything. When I went back 3 months later to have a test, it was 15.5. I was going the wrong direction, and I'm like, now what do we do? So then I went on the D, and then we checked it 3 months later, and then I was almost 30, because I guess the range is 30 to 70
I like
or
women,
something.
so like the endocrinologists who specialize in bone health will like women even to be higher, like 35.
Okay.
Technically, our normal range at the Med Center says 30 as well. I will let people slide at 30 and start taking a supplement more regularly, but we would really like people 30 to 35 for sure.
Yeah, and I haven't had it checked since because we moved, so I just have to find a doctor. But yeah, I just thought it was weird that when I was taking it like I should, then the numbers were going down, and it was didn't make any sense.
So when women are very low on vitamin D, like we check on a blood test and they're 15 to 20, 25, typically we replace them with a prescription strength vitamin D supplement that you take once a week. That's like a 50,000 unit supplement. So not a clear recommendation for checking that blood test routinely, as we kind of did for a period of time there at this point, but it's unfortunately, as you've seen, often a problem. And I check vitamin D's not uncommonly, and I'll get it back in a week. Our low is less than 10. It doesn't read anymore with that, and I see that a lot. So it's a common concern. If women have bone density problems, osteoporosis or osteopenia, your doctor should be checking a vitamin D. Some people make an argument if you have some heart disease or some risk factors for heart disease that we need to be looking into this. I always recommend to all my patients that you take one calcium and vitamin D supplement a day. And I don't want you to take more calcium than that for heart reasons also, actually. But a good, strong vitamin D supplement is good for us.
Now,
So we can't get too much from the sun.
Is the vitamin D that's in a multivitamin
Enough?
100%? It's 100%.
It might say that.
Yeah.
I recommend, so what's usually in a multivitamin is somewhere between 400 to 600 IU of vitamin D3. I would like my patients to get 1,000 to 2,000 of vitamin D. And vitamin D3 that you get over the counter comes in 1,000, usually 1,000 capsules. So 1 or 2 of those a day. A multivitamin is a good start. It's a lot better than nothing. But we don't get nearly enough. And unfortunately, we can't typically get nearly enough from our diet. For most vitamins and minerals and that kind of thing, we really like for patients to get as much as you can out of your diet. It's better for you, you absorb it better. But vitamin D, we just can't come close. And we can't with the sun either. Frankly, we probably shouldn't. It would take, I think it's somewhere between 15 and 20 minutes of sun exposure on basically all of your body. Wearing a swimsuit, it would be 15 minutes every single day to get the fair amount that you need. You shouldn't be being out of sun, honestly, without sunscreen on. So it's a good question. Any other screening type questions, please?
Are there any recommendations for women over 75?
Well, you're getting close to being off the hook.
Pardon me?
I said getting close to being off the hook. So I continue screening women that are over 75 that are in good health if they want to, okay? Like a colonoscopy, since it's so infrequent, a lot of people decide not to. If they had one at age 70, a lot of people would not do, elect to have another one. Mammograms, absolutely, we can keep screening. Some people would say that we don't need to. I think it's very clear for pap smears that we don't need to. Because a pap smear, a very early pap smear detected at age 65 probably wouldn't affect a person before they would probably pass away from something else. We're talking 20 years of growth. And for most people, that's not going to be a concern. I'm very comfortable being done with pap smears earlier in life. But a lot of screening tests, absolutely, we continue longer, especially if people are healthy and well. If people have a lot of serious illnesses, that's when we start considering backing away on the screening somewhat. Because it's likelier for them at that point. You know, if I have a very elderly, frail patient in a nursing home that has multiple cardiac problems, I'm not going to make them drag themselves in for a colonoscopy. You know, I just don't think that's appropriate.
But if you're
at
an
that point.
85 or 90-year-old woman who presents like a 65, 70-year-old.
Absolutely. My oldest patient is 103. I have let her off the hook completely. She comes once or twice a year. She's in sparkling health. So, but I have told her we're done with screens. The numbers just aren't there for her. So the second half that I wanted to talk about is about immunizations or vaccines. I think there's a lot in the news about these, but most healthcare professionals will be sort of ardent proponents of any vaccines that can be life-saving because they really are an incredible public health improvement. We're talking millions and millions of lives around the globe. When I was thinking about this, when I put this together, you know, it seems hard for my patients that are older than I am to believe, but there are diseases that I have never seen and I never will because of vaccines. I've never taken care of a patient with polio and I never will. I've never seen a patient with measles, ever. You know, it's still around. The only patient I've taken care of with chickenpox had AIDS. We just don't see these diseases anymore. And I think some of these things, people think, well, chickenpox, it's not a big deal. You know, kids used to get that all the time, but there are still a lot of complications that people can potentially get. So getting these is really important for both our, like we talked about, both our individual health and really the public health, because it protects everyone around us when we're vaccinated. And that'll come up with the first vaccine I want to talk to you about, which is a DTaP, or a diphtheria, tetanus, and pertussis. So these are all bacterial infections. Diphtheria people mostly have not heard of. It never happens anymore because everybody gets a good DTaP all the time. Tetanus, most people know about. That's lockjaw. That's what you get when you cut yourself working in your yard or in a car accident or what have you. Pertussis is whooping cough. And a lot of people don't know the pertussis name, but a lot of people know what whooping cough is. And whooping cough is out there. This past year, so kind of the fall and winter, Douglas County Health Department reported that we've had the highest rate of whooping cough since 1937. So this is back, and this is out there, and it's a wretched illness. Adults do get this. You think of it in little kids, and there's a pretty effective commercial that I've seen anyway with a little baby coughing. Adults typically don't get quite as ill, but this can hang on. I've taken care of a patient that had pertussis that coughed for probably 10 months, and he was like ready to tear his hair out by the end of that. You treat it with an antibiotic, but the cough just persists, and it's really tremendously frustrating. We also need to protect our children from, this is how we protect babies from getting whooping cough, that's why there's a real push to vaccinate pregnant women, because this is how you protect a baby that can't get a vaccine, is you don't give it to them in the first place by getting your own whooping cough vaccine. So I'm seeing more and more patients coming in, you know, women that are childbearing age and grandmas. I see a lot of grandmas that are, or grandmas to be, whose family member is having a baby and they know that they need to be getting this. So this is anybody age 19 and older. All adults should get this. And it's an injection into your muscle, so like into your arm or into your hip. People complain that this one hurts. It kind of does. You only have to get it every 10 years. It only hurts for a minute. A minute or 3 days, give or take. It does ache. I mean, I tell people it does ache. Get it in your left arm if you're a righty, whatever. The influenza vaccine protects us against the influenza virus, or what people call the flu. And I wanted to just clarify, because I find that it comes up a lot that people misunderstand what healthcare providers are calling the flu and what the public calls the flu. So when we talk about the flu, I mean the respiratory influenza virus that gives you a horrible deep cough, big high fever, shaking chills, bad body aches, bad headaches. You're sick in bed for 5 days. I had it when I was 25 years old. I thought I was going to die. It's horrible. Not stomach flu. So what a lot of people think of in the public as stomach flu is like a gastroenteritis, nausea, vomiting, diarrhea, that kind of stuff. They're totally unrelated. So this influenza is the respiratory flu that gives you the bad high fevers and the shaking chills, that kind of thing. Doesn't protect you from the stomach bugs. And so sometimes people will get frustrated and they'll say, I had my flu shot and I still got the flu, and then come to find out they're talking about the stomach flu. So they're very different things. This is recommended for all adults in the flu season, which is October through March. And there's a number of ways you can get this one. It can be an injection into your arm or into your hip. You can get it as a squirt in your nose for kind of that middle age range. Or a dermal injection, which is kind of new and really slick, and it's this little tiny needle that's almost invisible. And it just barely goes into your skin. I mean, the needle's like, you can't see me doing this, it's because it really is that small. It's just this little tiny thing. This is a super important one to protect both ourselves and everyone else. HPV, we touched on just a little bit when we were talking about pap smears. So HPV is the human papillomavirus. That's what causes cervical cancer, the vast, vast, vast majority of cervical cancers. So this is younger women, okay, Brianna's age, if you will, 19 to 26. And this is a series of 3 vaccines. So you get one, and you wait a couple of months, and then you get another, and then you wait a few more months, and then you get your 3rd one, and you're done. Okay, if anybody has ever had like a hepatitis B vaccine where you get 3 in a row, it's kind of like that. And this again is the injection into the muscle. This, you may have heard about this. This has kind of been in the press because this is actually approved for much younger people. Than I just said 19 because I take care of adults, and we're kind of talking about adults. But this is approved for kids from 19 to 26. So young women and girls get this as well. For our purposes, we're talking about adults. The pneumococcal vaccine, this protects against bacterial infections that come from the pneumococcal pneumonia, which is really like a family of bacteria, not one particular bacteria. This is the kind of infection that bacteria that causes pneumonia, obviously, ear infections, bad sinus infections, serious things like meningitis. Those kinds of infections are caused by these kinds of bugs. I wanted to make sure that people, I highlighted this for you guys too, because there's a fairly substantial change that affects a lot of people. This is for all women over 65, and it's been that way for some time, but it's now recommended for women that are 19 and up that have risk factors. And smoking alone is a risk factor for getting pneumococcal infections. So if you're 20 years old and you're a smoker, you should have had this. If you're 40 years old and you're a smoker, you should have had this, even if you have no other health problems. I think that it's easier for people to perhaps, you might have guessed, if you have asthma, lung disease like COPD, you're going to be at higher risk for pneumococcal type infections. But being a smoker alone is one of the criteria. Being a diabetic or having liver disease, this is not everything, but these are the most common things. For your younger woman, say that's 32 and needs this because she's a smoker, she's just going to get it once. And the current recommendation is that you get it again once you're 65 and it's been 5 years. I tell, if you're 32 right now and we're going to wait until you're 65, I suspect things will have changed by then. But that's the current recommendation. So it's not a recurring kind of thing, but one time to protect you from these infections. And if you're over 65, it's once and that's it forever. And this, again, is an injection into the muscle. The shingles vaccine. Have people heard of shingles? Someone unfortunately battled shingles. Oh, bless you. So she said, awful. It's terrible. I've never had it, but I take care of lots of people with it, and it's a wretched illness that I don't want anyone to go through. So we recommend this vaccine for women over 60 or women who have had it and it's been more than 6 months.
Oh, yes, it's been several years.
Yeah. So I would give it to anyone that's had shingles. I sometimes run into problems with insurance, but we deal with that as it comes. But this for sure, women over 60. Please.
It isn't true then once you have it, you don't get it again?
Unfortunately, no. Okay. It's a good question. So shingles comes from the virus that gives us chickenpox, which we have all had. Kids, shingles will go away at some point because kids aren't getting chickenpox hardly at all anymore. But you don't get rid of that. Once you have chickenpox, you have that virus forever. And it actually kind of lives in the nerves around your spine. And then what happens is it gets reactivated, often in times of stress, physical stress, emotional stress, when people just aren't quite feeling their best. And then it travels along a nerve. And so it's not like a rash like chickenpox is. It's chickenpox, but like in a stripe. And if that stripe is, say, on your cheek or in your eye, it can be a really potentially dangerous situation. Yes?
Is it true that shingles is often, because it lives in those nerves, I've heard that it's like started by like a incident where you've caused like force, like a fall or something?
Not that I know of, other than that kind of relationship to some physical stress. but it's not like damage to the nerve, so to speak, and it's not in a place that you have an injury typically. It just travels along a nerve, and it really kind of lives all throughout, so it can show up anywhere. It's just that it shows up in a very different way than chickenpox does. So again, if you've got it on your trunk, it looks like a stripe wrapping around from your back to your front usually, and only on one half of you. It's only on one side of you. Always. That's just the way it works. But it's horribly, horribly painful. It's really uncomfortable. And like I said, it can involve, if it involves someone's scalp or their eye, it can be really, really serious. So this, I think, is a really important one. Over 60, and it's just a one-time. I always like to make sure that people know about this one, too, because the younger you are when you get it, the more effective it is. It's not one of our most effective vaccines. It's not. I tell people it's very safe, and I always recommend it, but it's not the strongest vaccine out there. It cuts your risk by about 50%, which if you've ever had shingles, is probably well worth it. But if you're 70, it cuts your risk by about a third. If you're 80, it cuts your risk by like 10 or 15%. At that point, I don't usually give it.
Are shingles contagious?
So that's a good question. Shingles per se are not contagious because it's a virus that you already have. Okay, so you didn't get sick and get shingles. You've always had this your whole life. But we are very careful about exposing anyone that's not had that virus. So a pregnant woman, okay, we don't want them to be exposed to that virus because the last thing we want is pregnant when we get it, but we certainly don't want a baby to be exposed to it. Little bitty kids that have never been exposed to chickenpox, now kids get shots for chickenpox. Little bitty kids or people that have really serious immune compromise, so people that are here in the hospital, people that have cancer and they're getting cancer treatments, serious things like that, people that have had transplants. They're not contagious in the true sense, but there are some certain people that we have to be careful for. I usually tell patients, if you have shingles, if you can cover it up, it's probably fine. If you have shingles on your leg and you work at an office and someone down the way is pregnant, it's fine. Don't take off your pants and rub her with your leg. But it's not truly contagious. But there are some people that we have to be careful not to expose, basically. Most people have, how can I explain this? You can't give me shingles. I've had the chickenpox. I can no more get shingles from anyone else than the man in the moon. But if I've never had chickenpox, that's a different story. Like a fetus or a little bitty kid. Okay?
Well, and anybody that comes in contact with shingles, they won't get shingles, they'll get chickenpox if they've never had the chickenpox.
Yes, look at the
Because it happened to one of the moms when my boys were younger, that she had the shingles, her husband never had the chickenpox. And she didn't know what it was at first,
right.
And so he was rubbing her back. And then
because of her, bless his heart.
Yeah, so he ended up with the chickenpox, and yeah.
Chickenpox for most people is not a horrible situation. It's worse when we're adults. It's much more uncomfortable. Or else, we just don't feel sorry enough for kids. It's probably pretty nasty, honestly. For most people, it's not a serious problem, but it's a huge disruption. You can't go to work, active chickenpox. I mean, it's kind of a big ordeal. So, more healthy young celebrities. So, in terms of immunization, she's 25 years old. So, what does she need? HPV, absolutely. That series of 3 to protect her from cervical cancer.
Flu.
A flu shot every single year. It's a gimme answer. Every single human being should get a flu shot every single year. Absolutely. And then if I had on here, if she is a smoker, I didn't dive into her history this much. Maybe you know her. You guys are running around. So 19 to 59 is a huge broad age range. These are the things you need to be thinking about. You should get a DTaP at least one time, and then we boost you every 10 years, which is a TB. Influenza every single year, up until age 26, when you need to be getting the HPV series. And then if you have any of those risk factors that we talked about, getting that pneumococcal vaccine to protect you. All right, this is our last quiz celebrity. I picked her because I think she's lovely. She does have osteoporosis, I believe, but that shouldn't impact her vaccines. So, go. What does she need at age 66? Flu every single year. Pneumonia for sure, because she's over 65. Risk factors don't matter. She should get one.
She can get the shingles shot.
She should get the shingles shot. Yep. She should have gotten it 6 years ago. like I said, I like to get them as early as we can. So really, once you're at that 60 mark, I tell people to try and go ahead and get that done because it's more effective the younger you are. And then the influenza we talked about every single year, the shingles once. So this is my last one, and then I'm absolutely happy to take any more questions. I think that these things are critically important. I think sometimes, perhaps it's a bias in my work, but I think sometimes women neglect their own health, and getting these screenings done routinely, and it really is important to make sure that you're getting your annual exams, make sure that you're getting everything you need so you can stay in good health. Most people would rather do preventive kinds of things so that you can maintain your health rather than reacting to problems once they've already occurred. So getting those things like cholesterol screenings, diabetes screenings, getting your immunizations so you don't have to have shingles or whooping cough or anything else. And I just wanted to give people a little bit of an update and an outline so that you can really ask your own healthcare provider what's most appropriate for you personally. I did include a website on here that I really like to provide for patients because I think there's a lot of misinformation on the internet. I'm sure that's shocking to everyone. But the CDC has a really good website. And I wanted to show you that it has something that I thought was pertinent to our discussion today right now. Oh, ever so slowly. So the CDC's website, I always tell people you can be pretty confident of the information that you find on there. The CDC is a governmental organization that puts out a lot of our health recommendations. And if you have questions about immunizations, it has a whole special section for immunizations. Look, Celebrate Women's Health Week. And so there's a few ways that you can go about it on their website. It has this A to Z, can you see my thing? Okay, it has this A to Z index up here. So if you're thinking about, you want to look for HPV vaccine, what did she say? Who needs to be getting that? Does my daughter need this? That kind of thing. It's just a list, okay? It's just a big list of all sorts of information. And then you can just kind of look for what you're looking for. If we're looking for HPV, and then it'll give you some helpful recommendations. Who needs to be getting this? What is it? What's the vaccine about? That kind of thing. And then it has these in the middle, and it won't change. Their website always looks like this. It has these general topics kind of in the middle. So if you just kind of just want to browse, this is a good place to go for it. And then it also has for specific groups, as you can see here. And this I think is really nice. I like this. So general adults and then your older adults. And then specific populations. So as you can see, there's some certain groups here that their health recommendations are going to be very different. But if you look for women, then it has all sorts of really helpful stuff. Healthy living things, calendars. So this is one that I really like. If you have questions after you leave today, this is a really helpful website. And I'd be very comfortable with any information that you find on there. Okay, this is legitimate information from the internet. And that, unfortunately, can't be said for a lot of websites. So I like the CDC if you're looking for one. If you're looking for another one, I like WebMD. I'm pretty comfortable with things that I find on WebMD. So that's all I have today. Thank you for your attention, and I'm happy if you guys have any more questions to answer them.
I'm just curious, for the HIV patients, are immunizations different for them?
Yes, in a nutshell.
Okay.
There are certain immunizations that they ought not get.
Okay.
If they have, immunosuppression for a reason, like a shingles vaccine.
Okay.
Or the flu virus, they get the shot instead of the live.
Yep. Live, the flu spray that we talked about is a live virus. It's called a live attenuated virus. So I tell people it's broken. It's alive, but it's broken. And you can't get that if you have certain health conditions like having HIV. I think pregnant women aren't supposed to get that with you guys with them. So there's certain things certain folks that can't. My kids are delighted that they can. Because kids love shots, just as much as grown-ups do. Any other questions about screening, immunizations, or anything else women's health related?
Since the guidelines have changed for pap smears, and it's now every 3 years versus annually, do you still recommend women going into their position each year?
It's a very good question. I mean, as a physician, I'm probably biased, but yes. So somebody else asked a question earlier about having a breast exam every year. And I think that that's only one of the many very good reasons to go in for an annual exam every year. It's still a clear recommendation that women have a clinical breast exam every single year. And I think that we can get a lot done having those annual exams, even though most women don't need to have a pap smear. I'll tell you from my experience, women are much better about coming in for annual exams, I think, than men are, because a lot of women, sort of in the collective memory, we have to get PEPs every single year. And you're just used to going to the doctor every single year. And I do think it's a good idea. I really do. I will tell people if I just feel that they probably can go longer, but it's very rare, because I do like to get women in for that breast exam for sure.
And so there's no insurance coverage issues?
I actually have, not that I know of, I've never had a problem getting an annual exam covered. That may change. But for a lot of women, we can, if women have any other concerns that need to be addressed, that's a good reason to be in. And I will just tuck in your healthcare maintenance things that need to be addressed while we're there. And it's not common that women have no concerns whatsoever for an entire year. Sometimes they do, and I love those healthy folks. That's great. But I have never had any issues having insurance coverage for an annual exam. Any other questions, lingering concerns? Well, thank you very much, and thanks for having me.
Thank you, Dr. Boerner.